So you've been told that you've got fibroids. Well done, you're in the right place and you found the right video. This condition is common, but it's actually still not talked about enough or explained well enough. So let's strip out a lot of the misinformation about fibroids and the medical gaslighting that causes far too many people to be dismissed with heavy periods when they really could have benefited from some treatment. So I'm Brooke, I'm an obstetrics and gynecology doctor, and in this video we're going to cover why you might suspect that you've got fibroids, what they actually are, how common they are, how they're diagnosed, and the different ways that they can be treated. Whether you are dealing with fibroids yourself or you're just curious to learn more, stick around because this information could make a real difference. Here are 6 common signs that you could have benign tumours in the uterus known as fibroids. Firstly, heavy or prolonged periods. So periods that are lasting well beyond the typical 5 to 7 days of someone's period, with periods so heavy that you could even become anemic because your body isn't able to replace the iron quickly enough before the next heavy period comes along. 2 is pelvic discomfort or pelvic pressure, often described as having like a dull ache or a fullness in the stomach. Fibroids aren't typically painful, but they can be uncomfortable because of the pressure they cause. Number 3 is an enlarged uterus. Sometimes people can actually look like they are pregnant because their enlarged uterus can be really prominent and can stick out. 4, needing to pass urine more frequently. So this can occur if your fibroid pushes on your bladder. 5, constipation. And this can happen if the fibroids are pushing on your bowel. And then you can also experience pain during sex depending on the fibroid's position. Fibroids can cause a range of symptoms, and these can vary depending on their size, their number, and their location. Some people might not have any symptoms at all, and they might only discover that they've got fibroids during a routine scan or an examination or going for tests for some other reason like fertility. So what are fibroids? Fibroids, also called uterine leiomyomas, are non-cancerous growths that develop in or around the uterus. They're made of muscle and fibrous tissue, and they can vary greatly in size. Fibroids can grow inside the uterus, on its outer surface, or even within its wall. Now, it's important to remember that fibroids are not cancer. They do not increase the risk of uterine cancer. However, the size and the location of the fibroids can sometimes cause problems, and that's why understanding them is key to managing the symptoms. So how are fibroids diagnosed? Well, if you're experiencing symptoms, your doctor will usually start with a discussion about your medical history and a physical examination. So in the pelvic examination, it can help to identify an enlarged or an irregularly shaped uterus. Then you might have an ultrasound scan, so an abdominal or a transvaginal ultrasound is often used to confirm the presence of fibroids and determine their size and their location. Other tests, so sometimes you might have an MRI test or procedures like a hysteroscopy, where we look inside the womb with a camera. And these might be needed to get a clearer picture so we can map out exactly where all the fibroids are located, especially if we're thinking about surgery. How common are fibroids? Well, fibroids, these benign tumours in the uterus, are incredibly common. Research actually shows that 70 to 80% of all women will develop fibroids by the age of 50, although many may remain asymptomatic. They don't have any symptoms at all. They're also more common in individuals of African or of Caribbean descent, and those with a family history of fibroids. Also, hormones like estrogen and progesterone actually play a role in causing fibroids to grow. And this is why when you go through the menopause and your estrogen and progesterone levels fall, fibroids can often shrink or they stop growing after the menopause when hormone levels start to decline. Some people might only have 1 or 2 fibroids, may never know they're there. But often if someone particularly experiences very heavy periods or they've got an enlarged uterus, we go looking, we may find 20 or 30 fibroids, even up to 100. The number of fibroids isn't actually that important. The main thing is that you should be treated for your symptoms. So whether there is 1 fibroid or 24, you should be offered options to help to improve your life and options that align with your preferences and whether you do or don't wish to conceive, to get pregnant soon, and what other treatments that you might have tried. If you do, however, have surgery for fibroids, we would try to remove as many as possible in that main treatment. So trying to remove all the fibroids in one go if possible. Okay, so how are fibroids actually treated? Well, the treatment for fibroids depends on several factors, including the severity of symptoms, the size and the location of the fibroids, and whether you're planning to have children. Options include having no treatment at all. So if fibroids aren't causing you any symptoms, you might not need any treatment. They're absolutely fine, they're benign, and we can just leave them be. We can use medication. So tranexamic acid or NSAIDs, similar to ibuprofen, can help to reduce the bleeding that you have. And they can just be taken on the days that you bleed and not taken on the other days of the month. Then there's hormonal treatments like the combined pill, which contains estrogen and progesterone, or progesterone-only options, like the pill or the Mirena coil or the implant. And then if the symptoms are particularly severe, we might use something called GnRH analogues. And all of these options can help to manage your symptoms like heavy bleeding and stop the growth of the fibroids. Depending on where your fibroids are, the hormonal coil, like the Mirena or the Jades, might sometimes be used to help your heavy bleeding. But it might not be an option for you if the fibroids are actually within the cavity of the uterus, because they change the shape of the cavity, so it's not a good idea to stick a coil in there. There's also a newer hormonal option, which is called Raico, which is specifically targeted at reducing heavy bleeding from fibroids. But it's worth discussing this option with your doctor if it could be right for you. Next, we have non-surgical procedures. So we've got uterine artery embolization. So this is a procedure where we cut off the blood supply to fibroids, causing them to shrink, and it's usually done by radiology. It's not an open cut into your womb. Then there's focused ultrasound guided radiofrequency surgery, sometimes called Sonata. This uses a high intensity radiofrequency wave in order to destroy fibroid tissue. Then we've got more invasive surgical treatments like myomectomy. This means removing fibroids whilst preserving your uterus. So we might choose to use that in people who really do want to maintain their fertility. They're thinking of falling pregnant soon or in the future. We can do a myomectomy as a transcervical procedure, meaning we use a camera that's passed through the cervix into the uterus to remove all the fibroids that are located within the uterine cavity. We may also do myomectomy via a laparoscopic approach, which means we do a keyhole operation into your tummy. Or we can do an open procedure where a cut is made similar to a C-section or vertically up and down on your abdomen in order to remove very large fibroids. And finally, we've got hysterectomy. This procedure removes the uterus entirely together with all the fibroids, and it's a permanent solution for fibroids. We take them all out in one go. Of course, it's not suitable for those who want children in the future. Your doctor can help you decide on the best approach based on your own individual situation and your medical history. So to summarise, fibroids are common. Many people never know that they have them, but for others they can significantly interfere with their quality of life. The good news is that there are many effective treatments available, whether it's for managing symptoms or removing the fibroids altogether. So if you suspect that you've got fibroids or you're struggling with any of the symptoms, don't hesitate to make an appointment with a doctor. And if you've got any other questions about fibroids that I haven't answered, leave them below and I can make a follow-up video.